Welcome to Talk to Your Health. I'm Dr. Derek De Silva. Prescription drug abuse is on the rise, and there are plenty of warning signs and risks associated with this issue. Joining us today is Dr. Gabe Kaplan. He's the Medical Director of Behavioral Health Services at Bergen Regional Medical Center. Doctor, welcome to the program.
Thank you for having me.
So this is a big problem today. Why is this issue happening? Why is this so common?
Well, this is really, as you put it, a big problem, epidemic proportions. Everybody in the field is very concerned, the government is very concerned. And one of the problems is that some people feel that because these are prescriptions, these are medicines that are being prescribed by doctors, that actually abusing them or using them for non-medical uses should be safe. Just because, if doctors are writing a prescription,
Sure.
Why should this hurt me?
You know, one of the things that I've said for a very long time, and I've worked in the area of drug and alcohol abuse for many years, one of the things I've always said is that this problem stems from doctors not taking the time to listen and talk to their patients. What do you think about that?
Well, I think that doctors can do a lot more in trying to identify which patients are at risk. And so if we have a patient who has a history of previous abuse or there's a family history, we have to be careful. Also, we have now medication prescription monitoring programs.
Right.
So if you have some questions about a patient, you can check on a state database and see if people are doctor shopping, going to different doctors.
And we do that all the time. When people come in and they ask us this, we just don't do it. But what are some of the early warning signs? What do we need to look for?
Well, I think what we look for is a change in usual personality and habits. Somebody who's a good worker starts not going to work, like misses Monday morning, can't finish their job. In the more difficult types of severe symptoms, people are just giving up on their usual routine.
Right.
They look sleepy, they look drowsy, they don't perform well. They may have medical problems, unexplained medical problems.
So change in regular behavioral patterns from what somebody was doing before.
Yes, I think people really understand something's wrong with you, something's different about you, and one of the things to look for is there some sort of substance abuse.
Now, where do people go to help? Go to get help? Obviously, your center?
Well, fortunately, we have a lot of places. Bergen Regional is a large provider of mental health and substance abuse, so you can go there. But each community has their own center where you can go to. Help is readily available. We have good treatment programs, and your physician and referrals from your friends are good.
Wonderful. Thank you so much for joining us today.
Thank you.
And folks, here's what we're working on for next week. And remember, you can catch 12 to Your Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m.